We all work really, really well together. We work as one great big family that we all try really hard to make sure that the patient has this excellent journey. Each of the surgeons, they take each patient as an individual and they do their absolute best for them.
You've arrived on the ward, so at reception on the ward administrator will check your identification by asking you your name, your date of birth and your address, and he will generate 2 wristbands which you will wear for the duration of your hospital stay. He will show you to your bed space where you will be seen by one of the nursing team. We will review your theatre checklist or complete it. And that involves, again, going through your identification, checking if you're allergic to anything or intolerant to anything. We make note of that. We will also know whether you need to have blood work done this morning or not. You may or may not need to have a chest x-ray done. Your consent, we will review that with you, make sure it's correct and that you've signed it. Check with you that you've had a shower this morning. We'll provide you with a theatre gown and we will ask you to get changed into that once we've completed the theatre checklist. Any jewellery needs to be removed. Ideally, get relatives to take it home. And then once you're changed into your gown, you can either sit in the chair by your bed or get into bed. So then we need to wait until the theatre porter arrives on the ward, and he will bring with him a slip which will have your name on it, your date of birth and your hospital number. And we need to check that before we take you to theatre.
Now we're in the anaesthetic room. This is where we have all of our equipment. First of all, we have our monitoring. This is where we'll be placing ECG dots, some oxygen saturations probe, and a non-invasive blood pressure cuff on the arm. This is our anaesthetic machine. This is where we're going to give you oxygen just via the face mask, and we'll say take a few deep breaths before we go off to sleep. The next thing we need is just a small drip in the back of the hand in order for us to give you the medication. Once that's done, you'll drift off to sleep, and at that point, that's when we'll put the additional lines that we've discussed beforehand. At the end of the operation, we'll wake you up in theatre, where we'll give you some supplemental oxygen via a face mask, and we'll take you around to recovery.
You are now in the post-anaesthetic care unit, which we call the recovery unit here. Once you arrive here, you will be connected up to a series of monitors, which will monitor your heart rate, your blood pressure, and your oxygen saturation levels. You may also have an oxygen mask on your face, which will deliver you some oxygen for a brief period of time. You will also be assessed for your level of pain. If you are feeling any pain, you will be given some pain medication. If you are feeling sick, you will be given an anti-sickness medication, which will help make you feel more comfortable. When you are feeling more comfortable, we will then do a chest x-ray. Until this chest x-ray has been reviewed by the thoracic team, you will not be given anything to eat or drink. Once the x-ray has been checked and everything is okay, we will then offer you a glass of water. If you are feeling okay after that, we will then offer you a cup of tea or coffee, depending on your preference. When you are more comfortable, able to move, able to take a deep breathe and to cough, you will then be transferred to the high dependency or the ward area. Occasionally you may be kept overnight in the recovery unit. Most patients would be transferred to the ward or the high dependency area after a period of between 1 and 4 hours.
There will be a degree of discomfort and pain after your procedure, but that may vary depending on what type of surgery we've had done as well. I want to share with you some of the ways that we manage pain after surgery. Most patients, after coming back after surgery, will have a line either in their hand or in their neck, and to that attach, it's a device we call a PCA, which stands for patient controlled analgesia, which means that you are in charge. And the way it works is basically when you press the button, it delivers a dose of pain medicine through that line. That's one way of managing pain. The other sort of most common thing that we will often have is a infusion of another pain medicine that might be placed by the surgical team or the anaesthetist at the end of the surgery, and that infuses some pain medicines into your back or into the chest cavity, and that's called a perivertebral block, and it comes via a similar pump, but it's got a different color, so it's distinguished for us what kind of infusion we've got going. Lastly, there's a third way of delivering this type of medicine as well, and that's a small tube going into your back, inserted by the anaesthetist in theatre, and again that delivers a continuous infusion of pain medicine.